What are common side effects of chemotherapy? Part 2. So I will talk through 5 or so common side effects of chemotherapy. I may do a third video as well, I'm afraid, because there are lots and lots of side effects of chemotherapy. So one that cancer patients like me talk about a lot is chemo brain. So chemo brain is a mental fog that makes it difficult to think and difficult to think clearly. It is probably a combination of a bunch of things. So it may be chemotherapy attacking the neurons in the brain and some other things happening as well. Fatigue, which is a famous chemo side effect, that is probably one of the things that's making it hard for us as cancer patients to think clearly. So I'll try and explain what chemo brain feels like. Like I said, mental fog, kind of I would have times when I was on heavy chemotherapy where I'd be sat in a chair and it's time to go to bed, and I knew I had to get up, brush my teeth, get into bed. And the time between me making the decision and actually being able to do it was very long. And I don't mean like I was sitting there kind of trying to get the energy and willpower together. I mean, there's something else going on. Something that's like preventing you from thinking and acting. Chemo brain causes forgetfulness, or let's say maybe not causes, maybe involves forgetfulness for lots of people. Just things that would generally be quick and easy to think of or decide or think through or understand, they become very difficult. I've not heard of any like robust research about chemo brain or how to deal with it. I would suspect that dealing with some of the possible causes of chemo brain, like the fatigue, might help. Only thing that I found really helps with fatigue is the light exercise. Talking to other cancer patients about chemo brain, I think, is really valuable, because it's one of those side effects where we feel that health professionals, they can't really understand it because they haven't experienced it. It's quite hard to put into words what it's like. It's that joke from Hitchhiker's Guide to the Galaxy. Yeah. So traveling through hyperspace is described as being unpleasantly like being drunk, and Arthur Dent says, "What's unpleasant about being drunk?" And Ford Prefect says, "Ask a glass of water." And yeah, chemo brain is that kind of thing where like your brain is kind of steeped in like a soupy kind of fog. Very, very hard to describe. But other cancer patients experience it, so it's really worth talking to other cancer patients about chemotherapy. Now, another set of side effects are those related to the mouth. And these could be mouth sores, like inflammation of the membranes in the mouth. Mouth sores, ulcers, that kind of thing. So I guess those, you would maybe call those GI side effects, because the mouth is part of the gastrointestinal tract. However, there are also mouth side effects that are more related to the nerves, so more related to like the neurotoxin aspect of chemotherapy. where chemotherapy damages and interrupts the functioning of your nerves. So that may be, what's a good example? So like difficulty swallowing, so that can be caused, or it often involves like nerve issues, but also dry mouth. Dry mouth is a side effect of some chemos, because they, well, I guess, yeah, partly nerve related as well. They interrupt the nervous signal for like producing saliva. But then other nerve issues with your mouth will be things like first bite syndrome, which is often associated with oxaliplatin, which is a platinum-based poison used to treat certain cancers. I had oxaliplatin as a treatment, and I suffered a lot with first bite syndrome. So first bite syndrome is that when you bite into some food, you get these like shocks of lightning running up to kind of the top of your head or your eyes, that kind of area. And then as you continue chewing the food, that stuff calms down. So this is first bite syndrome. Other problems, again, because the nerves are kind of disrupted in your mouth, you'll often accidentally bite your tongue or bite the inside of your mouth, that kind of thing. Dry mouth, yeah, big problem. Getting ulcers and things in your mouth, that kind of thing. So doing your mouthwash really regularly, not an alcohol-based one, because that would really hurt. But if you could get a non-alcohol based mouthwash that hopefully doesn't sting too much, and really use that every time you eat, after you eat, every time you eat, and some other times as well. So yeah, you might want to be using mouthwash 4 or 5 times a day. There's also like taste changes, and those can be very distressing because some of your favorite foods will suddenly taste disgusting, and it's not a consistent thing. So stuff happens sometimes, doesn't happen other times, and that's a real problem if you're struggling to eat. Another common chemotherapy side effect is anemia, which is like when you don't have enough iron in your blood to carry enough oxygen. I mean that affects wound healing, affects your energy levels because of the lack of oxygen. You bruise very easily, that kind of thing. So I guess that brings me on to the next thing, which is healing in general. So with chemotherapy, it interrupts your body's self-repair. So the body has mechanisms to repair torn tissue, if you get a little cut or whatever, bruises, all that kind of, scrapes, that kind of thing. Healing takes much longer with chemotherapy. And a potentially related side effect, which is the last one I'll talk about in this video, is that with chemotherapy you're very open to infections. So like minor scratches might take a long time to heal, and you're more open to infection, so they're more likely to get infected, and that can be very painful. So you need to watch out for that. So cover wounds, make sure proper wound care, right? So generally you'd ignore a scratch or whatever, but definitely when you're in chemo, put on some antiseptic ointment, put a covering over, keep an eye on it. If it feels kind of hot, that's a sign of infection. If you see red dots, like a bit of a short distance from the wound, that again is like a sign of infection, I think. So that kind of self-care is really important with chemotherapy. You want to be doing your mouth washes, be keeping a diary of what you eat. You want to try lots of varied foods, because some of your favorite foods may taste horrific. If you're not able to eat because of difficulty swallowing, or if you're struggling to get the calories in, then make sure you get yourself some protein shakes. You can get ones that are like kind of medically designed. Ensure is the most popular one of that, or most well-known one. Ensure, there's three kinds. There's the one in a can. There's the more kind of milkshake type one in a little plastic bottle, and then there's the powder one that you mix yourself with water. I found the milkshake ones the best. There are lots of different flavors. You have to try them all, because flavors you may think that you'd like may be disgusting, and something that you usually wouldn't like, maybe the Ensure version's actually okay. Again, difficult eating, yeah, get some maybe protein shakes, other than Ensure, just like the bodybuilding protein shakes might be better. So yeah, self-care is really important, and soon I'll do a self-care video. Thanks for watching. I may do another chemotherapy side effect video sometime, but I think I've covered like 5 side effects in this one, 6 in the previous one. Yeah, okay, thanks a lot. Please post your experiences, post your questions as a comment, and I'll make more videos. Thanks.